Welcome, everyone. Thanks for joining us this evening. I'm Jonna, and I'm going to be the moderator tonight with Dr. Young. I also want to introduce Lori McKenzie. She is the new Director of Outreach in California, and she just wanted to say hello this evening to meet everyone, and then you will hopefully be seeing her in the near future out in the field. Thank you again for coming this evening, and I just wanted to also point out a couple quick features. Dr. Young is going to be doing a poll. So on your GoToWebinar panel, there's actually an area where you can answer the poll. And then also, if you have questions at the end of the presentation, we're going to allow a few minutes at the end. So feel free to go ahead and chat those to us in the question panel of the GoToWebinar. So without further ado, I'd like to introduce Dr. Young.
Hey, how's it going, everyone? Thanks for joining me here tonight. I'm sure that a lot of you have a lot better things we could be doing besides listening to me rant on. But regardless of which, thanks for joining. My name is Edward Young. I am the cataract and glaucoma doctor here at Pacific Eye Institute. And today we're going to talk about, a little different topic than what you're probably used to hearing me talk about. Which is tonight will be about intraocular lens technologies and what's new, what's different about them. Once again, it's quite a detour from my usual talks about traumatic cataracts and also train wreck glaucoma cases. So next slide. So, tonight we're going to talk about these two lenses right here. The first is called the Panoptix lens, which is a trifocal lens that's commonly used here in the United States. Have you guys heard of this trifocal lens, the Panoptix lens, by any chance?
You can go ahead and answer in the poll. Should be able to answer. All right, and they have.
Okay. All right. Well, since if you've heard of its lens, then this will just be kind of a review for you guys. But it's basically a trifocal lens that allows people to have excellent vision. Oh, what just happened here?
Oh, the poll just was, sorry, it was going, getting votes. Sorry, go ahead. We'll just keep collecting data.
Okay. All right. So basically, what it is that it's a trifocal lens that allows people to be able to see well for distance, intermediate, and also up close. And then the second lens that we're going to talk about here is going to be the VIVITY lens. Now, this lens has only hit the market about maybe a month ago in the United States. Once again, same thing. Have you guys heard of that lens before by a quick show of hands or a quick poll?
I'm doing that right now. It looks like there's a mixed result there.
Okay, all right. So basically, the VIVITY lens is an entirely new lens in that it is an extended depth of focus lens or EDOF lens. However, the difference between this EDOF lens and the predecessor of EDOF lenses, which is the Symphony lens, is that it is a non-diffractive extended depth of focus lens, which basically gives it a couple of unique properties that makes me really excited about it, and is actually the main reason why I'm giving this talk tonight, actually. So let's move on to the next slide.
Did it go for you, Dr. Young? Are you seeing it?
It's still on the poll right now.
Oh, let me close that out. I'm sorry.
Okay, all right. So, since some of you already have heard of the Panoptix lens, this will kind of be a review. As a result, feel free to just doze off. I know I will. The Panoptix lens is basically the trifocal lens that's approved for use here in the United States. What it does is that it allows people to have excellent distance, intermediate, and also near vision all at the same time while correcting any sort of underlying astigmatism. Next slide. So what the patients with cataracts actually see, well, here's kind of like a schematic representation of that. So Here on the left, you can basically see that patients who have a cataract will basically have blurry vision that's at distance and also at near as well. And also things will tend to have a yellow tint. And people who have had one eye done but not the other will almost always describe things this way. Now, when you've actually had a cataract done, but with a monofocal lens, plus or minus astigmatic correction as needed, you can see in the middle here, you have patients who can see very well at distance. However, it's terribly lacking for intermediate and also at near. The Panoptix lens, on the other hand, is the trifocal lens that basically allows for excellent vision for distance, intermediate, and up close, as evidenced by the schematic here, which shows that people are able to see their cup, their cell phone, and also their background quite well. Next slide. So how is the Panoptix lens different from previous iterations of the multifocal lenses? Well, so previous forms of multifocal lenses rely on these diffractive apodized rings, which basically means that they have these individual concentric circular rings on the lens that, it's very dependent on the pupil size to be able to allow them to be able to see distance, intermediate, or up close. Now, the downside to having an apodized lens is that it requires a pristine eye with a pupil that is completely normal. And that is because some of the more peripheral rings allow patients to be able to see distance. And that's because when people essentially look at far away, they basically have a pupil that kind of dilates slightly. Whereas when they're reading up close, then what happens is that their pupil constricts, and therefore it just uses the central portions of the lenses to be able to see well for near. The problem with that is that, for anybody who has a smaller pupil, so let's say if they have pseudoexfoliation, they're on Flomax, or any other problem, then they're not going to do well with that lens. Similarly, if they have an uneven pupil, let's say they've had a laser iridotomy, that also makes it so that they're really not going to be able to do well with those lenses. So the Panoptix lens is a little bit different. So what the Panoptix lens basically does is that it does have those individual rings similar to other multifocal lenses, except each of the rings actually contribute a portion of the wavefront to distance, intermediate, and up close at varying degrees. It's a small area of the lens that actually does this, about a 4.5 millimeter area. And so pretty much anyone who has a 3 millimeter size pupil or larger will basically have almost the full effect of the lens. And it's not as dependent on the pupil constricting and dilating to be able to get the full effect with this lens. Next slide. Now, the Panoptix lens is actually not the first lens, first trifocal lens in existence. In Europe, they actually have quite a few other trifocal lenses, but here in the United States, it's the only one that's FDA approved. The way that makes the Panoptix lens different from other lenses is that the Panoptix lens, sorry, let's go back. So when it comes to the other trifocal lenses in Europe, the way they do it is that they have 3 focal points where the light is split pretty evenly. They have a distance focal point, they have an intermediate focal point, and then a near focal point. Now, the issue is that, while this is great, one of the main issues with that is that the intermediate focal point for the other types of trifocal lenses is set somewhere in the, in the middle between the distance wavefront and the near wavefront, which is going to be about 40 inches away. But, let's be honest here. Right now, it's 2021. Most people, when they want intermediate vision, they want to be able to see their cell phone and also their computer without having to use glasses. Well, 40-something inches, that's way too far away for functional intermediate vision. And so instead, what the Panoptix lens does is that they instead created a quote-unquote four wavefront system. They basically have a wavefront for distance, which you can see on the left there. They have a first order intermediate, which is actually where the light is actually shunted towards the distance wavefront. A second order intermediate, which is at about 24 inches, 2 feet away, which is approximately the distance most people like to have their computers at. And then finally, a near wavefront to allow patients to be able to see up close. Now, having the first order intermediate that you see right there in the blank triangle basically being shifted towards distance, what that essentially does is that it gives the Panoptix lens excellent distance vision, which is what a lot of the multifocal lenses in the past have lacked. I've seen a lot of post-ops in the past, who have had a Restore, a Tecnis multifocal, any of those sorts of traditional multifocal lenses, and the most common complaint is that they have very significant difficulty sometimes with driving at distance and also contrast at distance as well. So next slide. With the Panoptix lens, on the other hand, the majority of the light, over 50% of the light that enters through the Panoptix lens is focused for distance. And so as a result, there's not been a single patient that I've actually had where I put a Panoptix lens in and people have complained about their ability to be able to see distance. And of course, you have the two-way fronts that optimize patients to be able to see well for intermediate and also for up close. Next slide. So what does the data actually show when it comes to patient satisfaction with a Panoptix lens? Well, these charts right here are a pretty good representation of what my personal experience with it has been. So, right off the bat, when it comes to implanting a Panoptix lens, the counseling starts in the exam chair before I even book them for surgery. I basically tell them you have about a 10 to 15% chance of glare associated with it, and patients are usually understanding of that. Now, have I had patients who have complained about that after the surgery? The answer is yes. However, similar to these numbers right here, what I found is that when I offer patients an IOL exchange because of glare issues, none of them would take me up on that offer because they love the versatility of their spectacle-free vision they get with the Panoptix lens. And that's exactly what the data shows, with 90 to 99% of patients saying that they are happy with the vision, they would get it again if they had to, and they would recommend it to their friends and family members. Next. Now, we're going to change gears a little bit and move on to the second lens, in this talk, which is the VIVITY lens. This is actually the lens that excites me the most, and it's actually the main reason why, me as a glaucoma guy, is actually giving this talk. And that is because it is the first extended depth of focus lens that is a non-diffractive lens, meaning that if you look at the lens itself, they don't have those little concentric rings on it that give it the extended depth of focus that previous iterations such as the Symphony lens does, but instead it uses a new technology that basically causes no loss of contrast and no significant glare, halos, or starburst patterns. And as a result, patients are always usually pretty happy with the lens, and they usually will not have any of those sorts of complaints associated with the trifocal or multifocal lenses. Now, as a result of this, because it's not a diffractive lens, you worry less about how it is that the eye, any underlying pathology in the eye is going to affect the patient's vision. And so patients with mild to moderate glaucoma, patients with epiretinal membrane, or diabetic retinopathy, maybe they've had mild CME in the past that's resolved. Those are patients that in the past would never qualify for a multifocal or a trifocal lens. But because we have the VIVITY lens now, it has actually expanded a significant number of patients who actually can benefit from having a premium lens. And, especially for me, that it actually opens things up a lot for my patients. So next slide. So this lens in the trials basically demonstrated this. So the main thing with the VIVITY lens is that just like the other extended depth of focus lenses out there, which is in the past the Symphony lens, it provides great distance vision. It provides great intermediate vision. For up close, it's designed to provide functional near vision, which means that it may not be able to necessarily provide perfect 20/20 for up close. However, it does provide a good enough vision that most people are pretty happy with it. And if they want to read fine print, they may need some light spectacles to be able to compensate for that. Next. So what do patients actually see and how do they actually rate their vision when they've had a VIVITY lens placed? So, here's what the study shows. And so in the green bars is basically patients who have been implanted with a VIVITY lens, and then to the right of that, the yellow bars is basically comparing, the same satisfaction scores on patients who have underwent a implantation of their monofocal lens, which in this case is their ACRYSOFIQ platform. So you can see that under both dim and also bright circumstances, it has excellent outcomes for distance vision between the VIVITY and also the monofocal lenses. And in fact, under dim circumstances, for whatever reason, the VIVITY actually outperformed the monofocal lenses at distance. Now, when it comes to intermediate, that's when you start to see that drop off between the monofocal lenses and the VIVITY lens. You can see that under both dim and also bright circumstances, the VIVITY lens continues to offer excellent vision at intermediate, whereas the monofocal lenses has a significant drop in the number of patients who say that they see well at intermediate. And then finally, when we look at near vision, you can see that the number of patients who are able to see well for near is about 2 to 4x greater with the VIVITY lens compared to the monofocal lenses. Now, it's not as good as, the distant and intermediate vision. However, you can see that there is a significant advantage for near compared to the monofocal lenses. Next slide. So what makes this non-diffractive lens special? Well, so this is what patients actually see when they actually have undergone different intraocular lens implantation. So on the left here, you basically have a person who's seeing a point of light after implantation with a monofocal lens. Now, on the right here, you basically have a patient who you can notice now you have that point of light, but also a halo surrounding it. And that's basically a patient who has undergone a diffractive lens, which in this case was the Symphony extended depth of focus lens. Well, in the middle here, you see that this is what the patient sees with a VIVITY lens, which is still an extended depth of focus lens implanted. However, it's a non-diffractive extended depth of focus lens. And so you can see that there's no glare or halo pattern associated with this lens. Next slide. So how does it do this? Well, unlike the diffractive rings that I had described earlier associated with Symphony or any multifocal or trifocal lenses, this lens, the VIVITY, does not have individual diffractive ring that splits light and allows patients to be able to see distance, intermediate, and up close. But instead, it uses something called X-wave technology, where instead of individual rings that split the light, they have a smooth plateau transition zone that gradually bends the light in the wavefront from distance into intermediate. Next slide. And this is what that looks like. So when you look at it under the slit lamp, it actually looks almost like a monofocal lens, except when you retroilluminate, that's when you can finally see that there's like this little donut-shaped area. And this donut-shaped area is what's responsible for gradually bending the wavefront to be able to transition from distance to intermediate/near. Next slide. Now, what this translates to is, when it comes to how does the wavefront look is like this. So at the top here, these are kind of like bars that represent how light is transmitted through the intraocular lens. So at the top here, it is the monofocal lens. And you can see that at the left here, you have a wavefront that's designed for distance. And then it kind of tapers off, and then it ends before it actually ever reaches intermediate range. Now, the Symphony extended depth of focus lens, which is the diffractive lens, you can see that there is a wavefront for distance and a wavefront for intermediate. However, there's a split right down the middle, and that's because that's owing to the fact that it's a diffractive lens that splits the light using the individual rings. Now, when it comes to the trifocal lens, which is the Panoptix lens, you can see here that there are actually 3 wavefronts. You have a distance wavefront, you have an intermediate wavefront at about 24 inches, and then a near wavefront. But while it's great for providing 3 locations where patients can see well, at the same time, however, it does split the light into 3, just like the other diffractive lenses. With the VIVITY lens, it doesn't do that. So at the bottom here, you can see that you have one continuous wavefront that basically is stretched from distance to intermediate, and thus it allows patients to be able to see well for distance, intermediate, and also have functional near vision without having a lot of those subjective visual disturbances. Next slide. Now, speaking of this visual disturbances, what is it that patients actually complain of most when it comes to having multifocal, trifocal, or diffractive EDOF lenses implanted? Well, it's usually going to be these 3 things right here: glare, halos, and starburst. So once again, similar to how they compared the quality of the vision after implantation, they compared the rate of these side effects between the VIVITY lens and also with the monofocal lenses. Why would they do that? Well, you can have the best lens in the world, but if it's not safe, meaning that patients are not happy with the side effects, then obviously it's not going to work well. Well, you can see here that when it comes to all three side effects here, which is glares, halos, and starburst patterns, the number of patients saying that they were not bothered at all by any of these three things is almost identical between a monofocal and also the VIVITY lens. And in fact, when it comes to halos, if anything, more patients actually complained about halos with the monofocal than with the VIVITY lens. Now, when you go down to patients who say that they were somewhat bothered by issues of glare, halos, and so forth, you can actually see it's the same thing. And if anything, once again, more patients actually complained about having glare associated with a monofocal lens compared to having the VIVITY lens. Next slide. So this right here is actually one of my own patients. And so what happened with him is that he has a history of uveitic glaucoma. He's had some mild to moderate visual field loss. And the main thing with him is that I actually did his surgery not because of his cataract, but because he actually had uncontrolled elevated pressures as a result of his uveitic glaucoma. Now, he did have visually significant cataract, and so since I was going to do an Omni procedure on him anyways, I told him I was going to take out his cataract. He was interested in having an advanced technology lens because he was still relatively young. He still worked and he wanted to be able to get more out of his vision rather than just seeing well at distance. So this was what I ended up doing. I did a VIVITY lens in both of his eyes with an Omni procedure, and he's now about 2 weeks out from surgery, and this is what he had to say. Your sound's muted, I think. Bring your cataract surgery. So what are your thoughts about it?
Based on your recommendation, I'm just so pleased with the outcome right now. After wearing bifocals for over 20 years and being free of glasses right now, I can see better than I have for, I can't even remember in how long. I'm just thrilled with my vision and the outcome. It's hard to explain how happy I am.
Great. And overall, your vision for distance and intermediate, pretty happy with the results there?
Yeah, my distance and intermediate are just incredible, and even my near vision is good.
Okay, great. All right, well, thank you very much. Glad you're happy with the results. All right, next slide. So
sorry, there we go.
All right, yeah, so basically, overall, patients are usually pretty happy with this lens, and that's because, it offers the same benefits as other extended depth of focus lenses, except, they don't have issues with glare and also halos and so forth. And so realistically, for patients who have a strict needs that they do not want to have any sort of visual disturbances when they're driving, especially at nighttime, those patients, they can benefit a lot from this lens. And also finally, patients who have some underlying pathology in their retina or their nerve that precludes them from otherwise having a advanced technology lens. This has opened a lot of doors for patients. Now, why am I giving this talk to you guys? So, basically it's like this, when it comes to cataracts, we know there's one, undisputed fact out there, which is that, there are a lot more people who are gradually getting older over time. They predicted that, between 2006 and 2030, the number of people over 65 is going to be probably about doubled. And as a result of that, the corollary is that the number of cataracts that need surgery is also going to increase significantly as well. You guys are going to be at the front line of all of this. So next slide. So, you guys are often the ones who are going to be seeing the patients first before they ever step into our offices. And as a result, you're going to be the ones who will most likely start diagnosing them with their cataracts. And also, as a result of that, patients may have already heard about their cataracts. They may have already read up on it. The year right now is 2021. It's not the 1900s anymore. Patients all will usually look this stuff up before they even show up in our offices, in your offices, and they may even know about some of the lens options out there. They may just start asking about them immediately. So, nowadays, as it being 2021, it's not enough to be able to just offer them 20/20 vision for distance. Patients want to basically be able to see well for far away. They want to be able to see well for intermediate, well for up close in order to be 20 happy. So, in this case, this basically is something that, a lot of patients will want to know about. They may ask you, and here at Pacific Eye, we're happy to offer pretty much the latest lens technology out there. We'll work with you guys. We'll basically have you like see your patients. We'll basically operate on them. If they have visually significant cataracts, we'll return them back to you happy, and that way you can continue your lifelong relationships with these patients. And hopefully, the patients will be thrilled about the outcome at the end. Next slide. Yeah, so basically, in summary, we welcome your referrals. We basically have been working with you guys for a long time. We'll continue to work with you guys for a long time as well. And, we'll just, our goal is basically to provide excellent care to all the patients that we see and to all the patients that you refer to us. And we'll be glad to basically, once again, return our patients that you refer to us back to you for continued care.
We wanted to pass the mic over to Lori for just a quick moment so she can introduce herself. She's the new Director of Outreach and Marketing in California, and so hopefully you will be able to meet her soon. So Lori, if you'd like to just make an introduction.
Yes, thank you, Jonna. Good evening, everyone. Thank you so much for spending your evening with us. We really appreciate your time. As Jonna mentioned, I am the new Director of Outreach and Marketing in the California region for Pacific Eye Institute, and I am working diligently on our co-management program, and I would love the opportunity to meet with you and discuss your interest in outreach efforts with Pacific Eye Institute.
Sounds great.
Perfect. Thank you. We'd love to open up the floor to questions now. So if you have any questions for Dr. Young or Lori, feel free to go ahead and chat those in the question box in the GoToWebinar panel, please. And we'll leave the last few minutes here for questions. Give everybody a second here. Perfect. Well, you might have it easy tonight, Dr. Young. There's no questions from the audience. Well, perfect. Again, thank you everyone for attending. Dr. Young, thank you for your time, and Lori as well. We hope to see you all soon in the near future when we can all get together again.
Sounds great.
Have a wonderful evening.
Here.
Thank you. Have a wonderful evening, everyone.
Thank you.